The concept of concussion is something that's actually changed significantly over the last couple of decades. Historically, it required a loss of consciousness, somebody being completely knocked out. It's widely known that only 8 or 10% of concussions actually result in loss of consciousness, that lesser impacts can cause very significant commotion of the brain, where the brain slides back and forth in its spinal fluid bath, and can result in dizziness, vertigo, headache, vomiting, a variety of other confusion. Can't tell which end we're actually trying to get to on the field. Those sorts of things are also concussion. The key is the period of rest after a concussion. You have to be out, non-stimulated, not playing computer games, not watching TV, not reading books, really at rest. And that allows the brain to recover from these injuries and come back well. If you don't do that, the young athletes, not the NFL, not the elite athletes, are subject to disastrous second impacts.
I think that there's this misconception that it's only football that gets concussions. We have certainly many other sports that can get concussions. So what we do is we do a baseline screening, which includes their history and physical exam, which history is the key. And I think, as with everything that we talk about tonight, the biggest dilemma that we face is honesty on the part of the student athlete, or the athlete in general. You know, these are athletes, they want to be in the game. So their main focus is, I need to be on the field. And so our main obstacle is just that, because they're not always as honest as we would like them to be. So what we like to do at Northwestern is we educate them right from the beginning. So in the process of doing the physical exam, I talk to them. If they've had a history of concussions, we talk about, you know, how those went down. Were they unconscious? Did they lose memory? And we just get a sense of where they're coming to. And again, unfortunately, sometimes they don't tell us those things. So if they have a clean slate, that's what they start with us, and then later on we find out, well, actually I had 5 concussions in high school. So that can be a difficult problem. But then we also do a neuropsychological test, which is a computer test. We happen to use Impact. There are several other, actually many other computer-based programs that are available. And it's a series of tests, and we have a neuropsychologist that reviews that as well. And so we have a baseline on all of our student athletes, so that in the event that they do sustain a concussion while they're at our institution, we can go back and compare what they look like after they've had their concussion to prior to the concussion. And that's helpful in determining if they're ready, because, like I said, we can't necessarily base it completely on what they're telling us.
The first thing I would say to players is, you have one brain. My knees are wrecked. A lot of people's knees are wrecked. You go through life, there's some attrition. This just happens. You get new knees. You can't get a new brain. So think about your brain as something very special. And I would urge trainers and doctors to tell young athletes the simplest thing, what a concussion is. To hear Dr. Batcher say, as we now know, you don't have to be knocked out. You don't have to be that guy in the middle of the ring unconscious. You can be someone who may not even know it. And so it's kind of scary. If I have to self-diagnose myself with concussion, it's very difficult, because toughness does tie in with all that. And your head, as I always say, the problem with football, it's in the middle of your shoulders. What do you do?
Young people are at risk of second impact. Second, I'm a neurosurgeon. When we operate on young people that have been traumatized, whether it's a car accident or whatever, their brains are hyperdynamic. They're hyperemic. They're red. The vessels are dilated. Bam, 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 with every heartbeat. And it makes sense that you take that brain after a concussion while they're still symptomatic and you hit it again. It is not rocket science to figure out what happens to the child. And Zach Lystedt is the poster child, of course, for second impact. And we were just in Seattle. The commissioner and the NFL brass were there, and we put on, with the governor of Washington, a clinic essentially on how to get a Zach Lystedt law passed. And basically the law has 3 components. It is that the parents and the student athlete are educated about the symptoms of a concussion, and they sign a waiver to that effect. Any concussion that occurs, the player is out of practice or out of play, and to return, they have to be cleared by an independent provider, and that could be a trainer, a physician, somebody who's properly trained. And these are totally preventable. But the young people are the ones that are at high risk. And as I'm sure Carrie would tell you, the highest risk sport in the NCAA is women's hockey. Number 2, women's soccer. Number 3, men's football. This goes across the genders, it goes across the ages as a substantial public health problem.
Well, you know, it's an excellent question, and it's something that I feel really strongly about. As a matter of fact, I just went to I have 2 daughters, but I went to their grade school. They play, from 5th grade on, they play tackle football. And I was just watching the parents, they kept asking me questions. And so I went and spoke to the parents club of all the football players, and the questions were just, some were the simplest things, and others you were just astounded by what they came up with. But I think there's still so much lack of education, and I think that's really the crux of all this, is that we need to educate the parents, we need to educate the coaches at all levels, from the Pop Warner level on up. And again, you know, football obviously has the most attention, but educating parents of all student athletes, and not necessarily even an athlete. Your child could be riding a bike and fall off, so if they're not wearing a helmet. I mean, I'm a huge advocate of helmets, having sustained a concussion myself after riding without one. So the education of the sacredness of the brain, I think, is probably the most important thing. And so as we educate our parents, they know their kids better than anybody. And you know, at the college level, we like to think our athletic trainers probably are like a mom or dad away from home. I talk about just what everyone up here has talked about, to both parents and coaches and student athletes, that we need to protect the brain. We need to notice those changes. Even colleagues or teammates, you need to notice if your teammate has something that's changing in them, if they're acting funny. You know, I can't tell you how many times an athlete has come up to me and said, you need to go check on so-and-so because they're not acting right. And we would have never known had they not told us. So I think the more education we get to everyone, the better.
First of all, I think there is a genetic predisposition to this condition. And that is when you look at dementing illnesses of all types, the ApoE alleles are going to be important, and that's going to be part of our database in the NFL to keep track of these folks throughout their life, not through their playing career. We'll know their genetic markers up front, and at some point down the road, it may be that a physician can come say, you know, Mrs. Jones, your son, if he plays contact sports, collision sports throughout a professional career, his chance of permanent injury is blank %. And it's going to be different for various genotypic variants. That's one of them. I think the armor is another. We're looking at all the new accelerometers, ways that we can measure impacts collectively over a player's playing career, both practice and games throughout their career, and that will be a part of it also. With new materials, DARPA is looked at a lot of novel ideas to protect soldiers from blast injuries. And I think we're going to be able to get those quickly into athletics if there are important ideas out there.
The one thing I wanted to also add was, I think similar to how we've looked at baseball and pitch counts in youth baseball pitchers, I think applying some of that research and looking at hit counts, you know, you're never going to get a coach to agree to cut someone off after a certain number of hits unless it's a mandated thing across the board. So it would have to be similar to how the NFL has come up with their new rules for concussion, and the NCAA has done the same. I think at some point that's what we're going to see happen, is that there'll be some sort of hit count that's kept track of.